six-year med program at UMKC. I graduated and then went to Temple University Hospital in Philly for emergency medicine. And then my heart's always been in Kansas City. So my husband actually matched in a retina fellowship here in Kansas City. And he was also in the six-year med program. And then there happened to be a spot here. So I think everything happens for a reason. And now I'm here and I get to, teach you guys, the future of emergency medicine. So I did give this talk at SAEM a year ago. So there is a similar version of this talk that is also recorded on their website. So I did use a lot of that content. Obviously, I want to give credit to all those that worked on that project with me. And so I have no financial disclosures at all. But it's this talk and then a little bit of me and my thoughts here. So I want to say congratulations to all of you guys because you know what you want to do. You want to do emergency medicine. VSAS is kind of its own little world. So you've successfully done that if you've gotten a visiting rotation. And then, so you've been accepted. So when you go through this process, you might get a lot of you might be accepted to a lot of programs. And you might have deadlines. So they might give you a deadline like, hey, you have a week to respond. Hey, you have 2 weeks to respond. And so you really got to apply to the programs that you want to rotate to. And then you really got to know, which one are you going to choose? If you've been accepted to more than one and you choose a different one, please, email that program saying, hey, I appreciate, the offer, but I'm not able to rotate at this time. Because then that gives an opportunity to another student. So it's great that you get a lot of offers, but make sure, you choose one quickly and then give other students the opportunity to rotate as well. So you're going to go rotate. So now what do you do? So essentials here. Who's your primary contact? So you kind of got to know that. Are you talking directly to the clerkship director? Are you talking to, their assistant or associate? Who's the one that's sending emails back and forth? And then things to think about is a flow. When you go on a visiting rotation, we automatically assume that you're going to want a slow. So if you do not request a slow, it's kind of a red flag, but we'll talk about that here in a little bit. But you do request a slow through ERIS, and I get emails letting me know at the beginning of a rotation, end of rotation that, they want a slow. I always assume so unless told otherwise, but it never hurts to just let the clerkship director know that that's what you're intending on doing. And so if you're very interested in a program, you can request to meet, with the program director, assistant program directors, clerkship directors. You can email them kind of expressing, your interest in the program. Don't send too many emails because, we don't want repetitive emails all the time, but if you're truly interested in this program, we usually take the time to at least sit and talk with you guys and get to know you a little bit better. And at our program at UMKC, we actually assign you a mentor, so someone that you can talk to throughout the whole interview process. And so that's usually one of the APDs, PDs. And so we really kind of get to know you throughout that mentoring period. So you got accepted, you're going to go to your favorite rotation. So how do you get ready for your first shift? So kind of get a feel for what the program is going to be like, because every visiting rotation is different. So is it going to be sub-I style? Are you going to be an intern? Are you going to be by yourself? Solely working by yourself with the attending? Or are you going to be working with the resident? So you'll see a patient, present to the resident, the attending. Maybe the resident's going to help, walk you through a lot of things. Or are you going to do both? Are you going to be able to work with, the attending alone, resident alone, and then kind of work individually on your own? These are always questions that, you can ask the coordinator, just so or likely read the website, because a lot of programs on their website will tell you kind of what program you're going to be going to, but you never want to show up and have to act like an intern and you didn't know you had to do that. And so always look at their website. So what do you bring on your first shifts? Make sure your white coat's nice and cleanly pressed. If that's the dress code that you want you in, make sure you have that. Is your technology up to date? Is your phone updated? Are you bringing an iPad, laptop? So make sure all those things are working. Your equipment, obviously stethoscopes, and then now with COVID, masks. Do you have your goggles? Do you have everything you need? So I would just get a list of what you might need, or on orientation, you might talk about things that you need as well. So make sure to take note. And then other things to know. So where do you go on your first shift? So at UMKC, we have a rounding room or a wellness room where you go and put your stuff at. And then you go out to the pods to round. Who's listening to your presentations? Is it going to be attendings, residents? mixture of both at the same time? Are you able to put in your own orders and do your own documentation in the EMR? Or do you have to do it separately on a Word doc, or do you do it in the EMR or on a student note? So it doesn't really count per se. So I would get an idea of, what's expected of you. And do you get to write orders? Like, do you get to, pick the orders and then send them to the attending or resident, or do you just verbally tell the resident or the attending what you would like to order? You need to know who supervises you for procedures. You'll likely never be alone, so don't go doing anything alone without letting the attending or the resident know what you're doing. They always have to be present at least for a part of the procedure, if not all the procedure. Know your role in critical care and trauma patients. So, for example, at UMKC right now, no student is allowed in the trauma bay. So make sure you're not the one jumping into a trauma bay and then everyone's like, what are you doing? Or if you have like a medical resuscitation, are you allowed to go inside? Can you participate? So I'd make sure you kind of understand what you are and are not able to do. And then who's going to do your assessment? Is it just the attending only? Is it the resident? Do they do a combination? Make sure you know who you got to talk to in order for them to fully be able to assess you while on your rotation. And then obviously COVID restrictions. Are you allowed to see patients that are COVID positive, short of breath, febrile, or do they prefer that you stay away from those patients? And every institution is different. So common pitfalls is this is an audition rotation. So this is your, one shot to show the program who you are. You try not to be that overeager student, read the room. You don't want to be that student answering questions for residents or trying to overstep your position. You're a student, you're there to look for learning opportunities, but you don't want to make yourself stand out in a negative way. But you also don't want to be too shy or quiet. And it's expected, being an audition rotation, we anticipate, it's scary. You don't know anybody, you're in a new, maybe city, new hospital. But, slowly start introducing yourself. You can start cracking jokes with people and, slowly become yourself. But at least try to make the effort, to talk to those around you. Be inquisitive, ask good questions. Don't make excuses for why you know something versus don't. So one of my biggest pet peeves is I'll, say something that the student, is supposed to think about, and they're like, oh, well, no, that can't be possible because of X, Y, Z. So when someone's, talking to you, and you might have not known the answer, it's okay. And it's okay to admit that you don't know the answer. If you say like, I don't know, I'm going to go look it up. I love that answer. So don't try to overcompensate. If you don't know something, you don't know something. We just appreciate that you're willing to go look for the answer. So know when to ask for help. I know everyone says, oh, fake it till you make it. Please do not do that. You can ask for help, if you don't know the right dose, or maybe the attending's talking about, thyroid storm, but you're confused about it. It's okay to ask for an explanation and ask for help. We love that. We love to see that you're engaged and you want to know a little bit more. Make sure to own your patients. A lot of students will, kind of see a patient and then not really check in on them, not really see any more medication, pain medications. So that is your patient, and that's the most important thing to remember. So do all the follow-ups that you need to. And when you're presenting or doing things in the ER, try to avoid saying things like, well, another attending did it that way, or that's not how I've done it in the past. So if I had to choose that's the one pitfall followed by the other one that I absolutely do not like. As an ER a resident, you're going to be working with attendings that do things so many different ways. So you're never going to learn a way that a does it. So that's emergency medicine. You learn everyone's different way, and then you get to make up your own way. And no one's going to have the same way of doing things that you do. So the last thing that we want to hear is, an excuse being like, well, another attending did it this way, or, that you didn't do that way in the past. We don't need to hear that. We just want you to, again, listen and take it in. And then don't send too many emails to the clerkship director or coordinator. It's okay to ask, some common questions, but not emails every day or every other day. And the biggest thing that I can tell you guys is it's okay to be wrong. A lot of students on their visiting rotation think, okay, I have to be the best. I have to be perfect. I can't make any mistakes or they're not going to like me. Don't put that kind of pressure on yourself. There isn't a perfectionist. I tell people you're a student forever. You're always supposed to be continuing learning. We're always going to be making mistakes. I mean, we make mistakes all the time. But you just get used to being okay with that and then learning from those mistakes. So we will, you might think a diagnosis that is way left field, but we're going to ask you questions. We want to know why you're thinking a certain way. Is there a way that we can get you to kind of go towards what we're thinking? Or when we ask you questions, we just want to know what you're thinking. And then we can, build off of that. But even if you're wrong, we're still going to inquire and try to figure out, why you're thinking the way that you are. And don't get worried if we're asking you questions. This is just how we assess, how we can better teach you. All right, so you're mentally prepared now. So what resources do you need? Here's some pictures of the resources you need. Pocketbooks or apps. I have people that still carry around your little pocketbook. I personally don't use a white coat anymore, so I don't have places for these little books, so I have apps. But a really good one for you guys to have, at least for visiting rotations, is the chief complaint. I think that'll really help you guys kind of figure out differentials and where to go. Because if you've never had an emergency medicine rotation, you've never really had to think about differentials, right? Internal medicine rotation, you're already getting a patient admitted from the ER that's been figured out. OB, they're having a baby. Surgery, okay, I got to cut out their appendix. So in the ER, you are trying to figure out what it is and what it isn't. So the chief complaint is very good in helping you figure out different differentials. And then pressors, pressors are always, something that will come up. So that's a good guide for you. Antibiotic guide, I can't tell you how many times I use that on a shift, but I do use the app, so I have the most updated version of that as well. And then minor emergencies are things that you don't really think of, but you'll see, more in fast track or lower acuity type areas. MD-Calc is going to be your best friend. Clinical decision rules are amazing to use in the emergency department. And there's EMRA fundamentals, emergency medicine secrets, 5-minute emergency medicine consult, and then, our holy grail, Tintinelli, or there's Rosen's that you can read as well. And so you do not need to use all of these resources. Some might not be the best way that you learn. So, pick and choose. But if I had to choose one that you should certainly have on your phone is MD-Calc and then the chief complaint. So other resources, if you're more of a podcast person, EM Basic, Core EM, MRAP, and MCRIT are really good. I use MRAP and MCRIT the most, but during residency, I used all of those. But as an attending, I still use these podcasts. And then websites, every resident uses WikiEM, and the information there is pertinent and usually up to date. But yeah, WikiEM, RubbleEM, Life in the Fast Lane. Life in the Fast Lane is going to help you with everything EKG. So I would get those websites bookmarked. So your pockets are full, your phone is filled with apps. So how do you become an effective member of the team? So you got to become one with the team. So with the residency and attendings, you got to say hello, introduce yourself, help when needed. You got to balance your, eager versus too eager. I don't expect you to go rushing cleaning rooms or anything like that, but if someone's screaming for help, I hope you're going to go help them. Or, if a patient asks for water or, a blanket, I hope you will do that instead of, asking the nurse to do it. So it's just the little things. And then know that you are part of a team. A lot of students feel that they're just the student and don't really feel like they're contributing to the team. And we can tell when you feel that way. So know that you are a part of the team and you are here because we chose you to be here. And we want you to help us out during our shift. So don't ever feel like you're not wanted there. And then nurses, social workers, case management, say hello. I'm sure you've heard nurses save, not only people's lives, but lives as well. They taught me a lot in residency. So, make sure they know who you are and who you're taking care of, know what's available, they'll help you find, different things that you might need. And always say please and thank you. I can't stress that enough when you're asking someone to do something for you. They can't be as upset if you say please and thank you. So make sure to remember your manners when talking to everybody. So you gotta be humble and hungry. So eagerness to learn, don't overdo it. We can tell, what's genuine versus not genuine. You gotta, humility to know your limitations. I don't want you pretending to be someone you're not. If you didn't do something, didn't ask a question, just tell me that you didn't do it. Absolutely no lying. That is a huge red flag. So please, if you ever didn't do something or didn't write something down or whatever, do not lie about it, because if you get caught, there's a lot of repercussions that can come with that. And then just be teachable. We want to work with students that we can just have great conversations about, bounce ideas off of each other, and just, get along, kind of, feel each other out. Even if we, think differently, we're able to at least teach you something while on shift. And then do things because it's the right thing to do. Don't expect to get a gold star. So like, have students be like, oh yeah, my patient was thirsty, I got them water. I'm like, okay, cool. Or the patient was cold, so I got him a blanket, or, things like that. I mean, we see it. We see a lot of things. So, do things because you want to do them, but you don't need to make it known. It's like holding the door open. If you get mad because they didn't say thank you, then why are you holding the door open, right? You want to do that because it's the right thing to do, and, it makes you happy inside. So unfortunately, you got to embrace this gut. So, figure out what your role is in helping the department flow. Is it you're going to be doing a lot of laceration repairs? Are you going to be splinting people, after the resident has seen them? Are you, reassessing, patients? That's super important. And then patient satisfaction is everything. I'm sure you've heard about, Press Ganey scores and things like that. But you being there when they're having an emergency and you're able to do the little things like blankets or get them food when you're doing a PO challenge, or, maybe a family member screams out and they want to tell you something. I mean, those things matter. So make sure to be, aware of those things. So you introduce yourself, so you're ready, but how do you see a patient? So you got to take a deep breath because it can be scary. Remember to figure out who you got to update, resident, attending, or both. Start with one patient at a time. Don't be that one, seeing 3 or 4 at a time. Go slow. It's okay. We don't expect you to see that many patients when you first begin. You can ask to see more later, but don't bite off more than you can chew. If you're like, hey, I can see 2 or 3 patients, you're forgetting orders, not writing notes, that doesn't look good. So make sure you do things that you know that you can do and do it right. So you got to state your plan, look things up. Looking things up, I still look things up, so that's okay. And be ready to explain, why you think something. Know your labs and your imaging. So if someone has a white count of 20, I want you to tell me what's next. Or if someone has a broken bone, I want to know what's next. So instead of reporting it, I want you to tell me and interpret it. And then you got to do frequent reassessments. Patients are, constantly in pain or throwing up. So if that's the case and we give them Zofran, I want you to tell me what you want to do next. You want to give them Reglan and Comzine, but I'll go more into detail about that here in a little bit. So it's hard because as a med student, you're kind of a reporter. You kind of regurgitate what the patient told you, but you don't really interpret your findings. And so in the ER, you got to put everything together. So you got to figure out if they're sick, not sick. Look at their vital signs. The ABCs, you need to run and get your attending or resident. So be cognizant of those things. Collect your information. Try not to use paper. We'll talk about that here in a little bit. Do your assessment and then a plan. So make sure you always have a plan. Don't present to the attending and be like, I don't know what to do next, but we'll talk about that here in a little bit. You got to remember that we're all in this together. Never feel that you can't ask questions. I mean, we appreciate the questions. We love the questions. That means you're engaged, you're paying attention. You really want to learn, what we have to tell you for this. And we all depend on each other. I couldn't do things, without my nurses or residents or, students. So don't ever feel that, you're not part of the team and that you can't ask us for help. So you've gathered all your info. So you have a plan, but how do you present? So presentations are probably one of the hardest things that students will encounter while on emergency medicine rotations, because you got to do it fast, you got to do it, concisely, and that's really hard. Ideally, you want to do less than 3 minutes, because let's be real, ER doctors, we kind of have ADHD. Like we want to hear the important stuff like ASAP, so we kind of know what we're working with. But maybe on medicine, you're telling like 5-10 minute, presentation. So this is new, this is different. You got to be thorough, yet concise, which is a skill that takes a lot of time. So don't think you need to master that skill by the end of the rotation. We just want to see that you're starting to do that. You got to include like important positives and negatives in your HPI, which we'll get to that in a little bit. And every attending has a different style, and it's okay. They ask the attending at the beginning of the shift, like, hey, how do you like your presentations? Do you like sick versus not sick first? Do you like, all the past medical history in the first sentence? Or do you want me to start off with what I think the diagnosis is? So it's always okay to ask what they expect. So I will tell you, every attending I had always had something different that they wanted. So after you present, your HPI and physical exam, this is a mnemonic that I tell students to use. So when you're kind of doing your assessment is, summarize. So quickly tell us, history and your findings. narrow the differential diagnosis. So be, crossing things off your list because, you did this on physical exam or something like that. And then you got to analyze the differential diagnosis. So really think about this, like, okay, well, I just used the PERC score. I don't think they, could have a PE. And then probe. So this is where you ask this question. So if you're not certain about something, let us know, and then state your plan. And then after you're done with that, select a case that you can read upon later. I can't stress how important it is to read about your patients after a shift or while it's happening, because you see it and you read it, and I feel like you remember it better that way. So this is, about presenting. So you are a storyteller. You have your, opening one-liner, and then eventually we get down to the differential diagnosis. But the key when presenting is I should be able to guess everything on your differential diagnosis by the time you're done presenting. And so that may not make sense now, but we'll talk about that here in a little bit. So your oral presentations, the chief complaint, what's going on, history, it's got to be relevant and focused, physical exam. So many people forget the vitals. Don't forget the vitals. Your summary statement, differential, and plan. Now, again, every attending does things differently, but this is kind of the flow of things. So your one-liner. So as you can see, there's two different one-liners here. So the first one, is more thorough. We know what their past medical history is, versus you tell me a 56-year-old with superficial rib pain. I'm like, okay, that means nothing to me. When you tell me they have a history of like hypertension, hyperlipidemia, I'm like, oh man, this could be something really bad. So it's always good to at least, tell us the pertinent past medical history. I personally like all the past medical history. So again, this is asking your attending what they want to do, but knowing their past medical history can change your whole mindset. So hearing their past medical history, with this chest pain for 3 days, in my head, I'm like, okay, well, it could be, ACS, could be dissection, things like that. So when I'm listening, I'm already starting to guess like what you're trying to get to here. And so for your HPI, it's really hard, you got to be concise, organized. You got to put everything that they told you kind of in a short paragraph. And it can be, super short, one-liner type things about their chief complaint, and then present positives and negatives. So, if you said this person was coming in with chest pain, I'd be like, no history of recent travel, no hemoptysis, no history of DVT, PE, and not on birth control. And I'm like, oh, okay, they're thinking about a PE, but they already ruled it out. Or if you're like, oh, no history of cough, fevers, sick contacts, I'm like, okay, well, maybe they're thinking about, pneumonia. So that's what I mean with pertinent positives and negatives. And so I'm able to guess what you're thinking. So physical exam, like I said, vitals are real, and interpret them. I don't want to hear, oh, vitals are normal, or, if a blood pressure is high, then tell us it's high, and then tell us the number. And then a focused exam. So if I have someone that's here with toe pain, why do I need to know a neuro exam, if there's no concern about dissection or anything like that. So make sure it's focused, and again, pertinent positives or negatives. Then the ones that you focus on, like the pertinent systems, we're going to be able to, think with you. I'm like, okay. If you looked for pulses, on their arms, groin, legs, you did strength, on this person with chest pain, and you took blood pressures in both their arms. I'm like, okay, all right, they like ruled out dissection. So that's what I mean when you tell us like those pertinent findings, that I'm able to kind of think through what you're thinking. And then summarizing. Some people don't like to summarize, but you're allowed to do that. This is where you put, all the important information in, you put everything together. And as you can see, this is very blunt and to the point, right? So it's going on 3 days, they're a little tachycardic, the blood pressure is high, all the physical exam findings that were normal, like that's it. So there's not much to it. But like I said, not a lot of people, you don't always have to do this, but it could help you before you present. So you can do it for yourself, but you don't necessarily need to say that out loud. And then for your differentials, spit model is pretty good. Again, everyone's different, but serious ones first. So ones that you can't miss, probable what you think it is, interesting ones, and then treatable ones. This is, you'll get into your own flow, but for now, that's kind of the way that I have students start at the beginning if they've never really had to develop a differential diagnosis. then your plans. So plans are hard, right? You've never had to create a plan before. So make sure you do diagnostic, therapeutic, and disposition. So I want to hear about everything that you want to do. If you're going to tell me meds, I want to know how you're going to give it, what the dose is. And then if you think they're going to go home and get admitted. And it's okay to be like, I want to wait till things come back to figure out if they're going to be admitted or sent home. That's fine. But these are things to kind of keep in mind. I don't want you telling me like, oh, they have pneumonia. I'm like, okay. And then I'm going to give antibiotics. I'm like, okay, which ones? So you need to know those things. You need to know exactly what you're going to give, how much, and why. So you can do it 3 minutes or less. So notes can be super helpful. And I do almost every single med student starts paper, goes in the room, writes everything down, comes out, writes it all organized, you know. But these are helpful, but until you can ditch them. So ditching them is super important. And it actually, you'll realize that you can actually have more concise presentations if you're not writing everything down, because you're not focused on, oh, I missed this, I didn't say that, and I wrote it down. You'll actually realize that you remember like more of the important stuff when you're not reading it off a piece of paper. And patients don't necessarily want you writing things down in front of them, but if you need to do that at the beginning, that's fine. But my goal for everyone is for you to be able to ditch them at the end. And then practice makes permanence. So the more you do it, the more that you'll be able to do it right. So you presented, you made it through the shift, and it's feedback time. So this is one of my favorite quotes. Without feedback, mistakes go unnoticed, good performance is not reinforced, and clinical competence is achieved empirically or not at all. So maybe you've gone through, you know, all of med school, no one's giving you feedback. You don't know what you're doing right or what you're doing wrong, and no one's there to help you be better. So feedback is essential for your growth as you become a physician. So know what you're supposed to do when you're getting feedback. So pay attention to orientation, read the syllabus, Canvas, Blackboard, know what's expected of you so that you know that you're doing that and that you can get feedback on those things. And you should ask for feedback. You know, everyone assumes, you know, that the attending is going to do it or that the resident's going to do it, but we have a million things going on at the same time, right? And so some attendings do give feedback, you know, on their own, but you should be the ones asking for feedback at the end of the shift. Hey, you know, did I do this right? Or, you know, what could I do better? Or sometimes I have every student tell me a goal at the beginning of their shift, and then I can give feedback around that. And you can ask for specific feedback. I have students after they present like, okay, what can I do next on my HPR? What can I do better? I like that. I like people taking initiative of their feedback, because all teachers, we would love to give feedback all the time, but it slips our mind sometimes. So if you remind us, we'll do it. And then remember, feedback is hard to hear. No one wants to hear that they didn't do something correctly or, you know, they got something wrong. So keep that in mind. If you're going to get feedback, you're going to get, you know, honest responses. So be ready to hear that. So find the appropriate time. Good times to get feedback: end of shift, maybe the middle of the shift if it kind of slowed down a little bit, or right after you do a presentation or a procedure. You can do this as frequent as you want. If you want to ask for feedback after every single patient, cool. If you want to wait till the end to kind of summarize everything, great. Just figure out how you like to get your feedback. Don't ask us for feedback during traumas or resuscitations, or if, you know, we're seeing 20, 30 plus patients. And if for some reason you can't do in-person feedback, it's always okay to kind of send an email and be like, hey, what could I do differently? So incorporate your feedback. Remember, perfection doesn't exist, so it's not expected. Listen to your feedback. Try not to talk back, and don't get defensive. Again, a lot of people haven't gotten this before, so people do kind of talk back and make an excuse for why they did that. But again, just listen. No one's doing this to be mean. Everyone's doing this because they care about you and they care about your future. So just kind of take a moment to take it in and then think about it, and you can apply it to the next shift. I love seeing when students incorporate feedback on their next shift. So again, this is not to be mean. This is not to do anything. This is to help you be a better physician in the future. So yay, you made it through the rotation. So now what do you do? So you can send a thank you email to the clerkship director, coordinator, but this is not required. Slow email. So if you didn't do it at the beginning, you can do it now at the end. You can send it to the clerkship director via ERIS. And then, you know, we'll upload it when the time is right. If you don't ask for a flow, it's a red flag. We kind of interpret that as, okay, well, they just kind of use this as a filler, not really interested in our program. So if you're going to be going on away rotation, the expectation is that you're going to get a slow. if you don't ask for one, you kind of start asking questions. So remember, this is your one shot to show the program, who you are. You got to be on your best behavior. You got to give it your all. You got to make sure you're doing your best, and you got to have fun while you're doing it. Learn as much as you can, and just be yourself, not someone that you think you want us to be. Just be who you are, and no matter how you are. As ER people, we just adapt to anything. So I don't want you to pretend to be someone you're not. The beauty about ER is, we're all different, and we all embrace it. So remember that when you're going into a rotation. Okay, so I went through that kind of fast so I could answer some questions here. I'm gonna go to the chat really fast. Okay, nothing, just give us a follow. Okay, so I'm gonna exit out of this really fast and take some time to answer your questions.
So we as a leadership board also had a couple of questions that we put together in case anyone hesitated to, but I'll ask a couple of questions, but if anyone thinks of anything on the spot, feel free to call it out in the chat or type it in the chat box if you're more comfortable doing so. One of the questions that we are wondering is that we know that you do have to stratify students as being in the top 10, top third, middle third, bottom third, in terms of how your program has seen students. So I guess we were wondering, from your experience, what sort of behaviors or qualities have really differentiated students into the top 10 and
So that's a hard question to answer because, I talked about everything that's important in this PowerPoint. And, I will tell you that I would rather take someone, has a go with the flow personality, really incorporated feedback, really, gelled with the team, maybe doesn't have, the highest scores, but, they're teachable, they want to be there versus, someone, maybe there was some professionalism issues, maybe, but they had the highest, board scores. Maybe we thought that they weren't being genuine. So it just kind of all depends on how you act, what your behavior is. Do we feel like you progressed, throughout the month, and things like that. If you're quiet the whole month, then it's really hard to kind of figure out how you would get along with the team. So what we're looking for is just, a new person that's going to help make the program better. So that's why I say this is your one chance to show us, who you are. I wish there was an algorithm that I could tell you, top, bottom, middle, but there isn't. So, and it all depends on who rotates too, because that's all we have to compare to for that year as well.
Anyone else have any questions at this time? Okay, and your presentation was already so thorough, so you actually kind of, seamlessly went through a lot of the questions that we were anticipating as well. One thing we were also wondering is if, say, your audition rotation is coming up in 1 week, what skills and reading EKGs or practicing a lac repair would you recommend trying to absolutely have down by day one?
This is also hard, right? Because you're going on a visiting rotation to learn. So if I have a visiting student that doesn't know how to, sew a wound, great. I get to teach them, and hopefully at the end of the, rotation, they know how to do it. Ideally, you should know basics about everything, but I'm not going to be disappointed if you can't, interpret this EKG, to a T. I'm going to want you, the biggest thing that I want from students is to look things up when you don't know it. So, and I tell people this, when they match as well, going into their intern year, they're like, should I read all my last months of school? What should I do? Should I do all these things? And I'm like, no, just enjoy your life. You're going to have time to learn these things. And I feel the same way with visiting rotations. Take some time, download the apps that I said, get your books, you can skim through them. But really taking advantage of what you can learn on shift is super important. So I can't tell you, one skill that you should know because I have the expectation that no one knows anything and then I get to teach them. So, yeah.
Awesome, thank you. Another question we are wondering is, some rotations do offer like interviews along the way. And then with this year, most likely virtual interviews being the plan. Do you have any tips for standing out on virtual interviews or any specific etiquette to try to follow?
Yeah, so it will be virtual interviews this year. And so last year, and I'm actually working on a guide for this, so it should be coming out on Cord. But virtual interviews are hard because it's like this, right? You only know like what my face looks like, what's behind me, is my lighting good? And so I think, so I'll just quickly walk through. So you gotta, practice, make sure you know Zoom. Are you gonna be someone that's wearing like big headphones or like, is your internet okay? Is there a lag? So you got to figure out like all the technology first. And then lighting, obviously you want yourself to look good. So yeah, getting a ring light, not sitting like in front of a window. So you're all dark. So making sure you're like, that's all good. Dressing in professional clothes, including pants, because we did have people that only had professional up top and then accidentally get up. So I can't stress enough how important it is to wear all your clothes. And then background. So this is something that I feel like evolved over time. A lot of people were doing interviews like on a white wall, but we slowly figured out that we liked applicants that kind of had things that we could talk about on their wall. And so that was kind of fun to kind of bring up, if people had, traveled to Mount Everest, there's a picture of Mount Everest or their bikes on the wall, like stuff like that. Like obviously not a huge clutter, but little things that, can kind of bring up conversation or kind of show them who you are. And then practice talking to people over Zoom. I feel like people's voices kind of get a little shaky sometimes, or, you kind of freeze up when you're talking on Zoom. And so that's something else that we kind of look for. And so we do keep in mind that some people are better at talking over Zoom than maybe in person. So there's a lot of things to kind of take into consideration, but I can tell you, we're not going to get to know the true you because you're not in person. And so I feel like what you can do over the internet is, what we can see here, what we can see behind you. And then just, asking really good questions or, bringing up stuff that we can kind of talk about. If I ask you a question like, I don't know, where did you travel to? And you're like, New Zealand. And that's it. I'm like, okay, like, you got to be able to keep the conversation going. So those are things I really enjoy. And I really love when I don't have to read off my list of questions because our conversations just keep flowing. And then I, end up talking about random things. So those are the best kind of interviews to have.
I do have a question. Could you maybe, because I have no idea how like the virtual interview works. Like I've heard a lot about how the in-person interviews usually work, but I've actually heard nothing about how like the virtual interview process works. So could you maybe walk us through what that looks like, at least at UMKC?
Yeah. So through UMKC, we do it through Zoom. So it'll be like this. And then you have, your interviewers, and then you have you guys. So you'll be like in a room like this. And then the interviewers get put into different breakout rooms. And then there's someone monitoring and moving you guys to the different interviewers. And so you'll have times where you're just kind of hanging out with other people who are on a break in this room, as well as a coordinator. So this is a time, you can turn your camera off, or you can ask questions of the coordinator. There's probably a resident hanging out too, so you can make conversation with the resident, which I encourage because then we remember you a little bit more. And so you'll be told when you're going to be put into a room. So you pop into a room and then you get notifications across the screen that's like, okay, you have 5 minutes. Okay, your interview's over. So make sure you try to end, when the interview's over. And then you got to know if it's you leaving the room or if it's the person interviewing leaving the room. So at UMKC, I never leave my little room. People just get put in it. So that's always important to know because I've heard of programs doing it the other way as well. And so that it's pretty simple. So you probably don't need to do too much. I always, we get people's phone numbers because Zoom, people's internets go off. So then we just do the interview via like FaceTime or over the phone, which we had to do. And that's fine. We have backups. But another thing that we've been doing are virtual hangouts the night before, which are like this, everyone's like drinking a beer, hanging out, asking questions. And so I would, encourage you to go to those, but be ready because everyone's gonna be trying to ask questions at the same time. And you know how it is when like lots of people are talking on Zoom, you just can't hear everyone. So again, take a deep breath, use your little like raise your hand emojis or type in the, box or, direct message your resident, it's okay if you're not like talking all the time, but don't be that, student that's talking the whole time and not letting other people ask questions. So it is frustrating. I wish there was a better way that, we could have these virtual hangouts, but that's what they are. So you just got to make the best out of it. And I feel like being able to use those different Zoom features is super helpful.
I have a question.
Mm-hmm.
You mentioned earlier that you guys don't allow students in your trauma bay. Is that a COVID policy, or has that been like your policy even before COVID?
No, so it was just started with COVID. We have a lot of asymptomatic like trauma patients that are COVID positive. And you know how it is, like during the daytime, there's like 20 people in the trauma bay, I feel like. So that's a lot of PPE. That's a lot of people getting exposed. I know if you're on like a sub-I for trauma, I believe they let you in now. But that is the trauma department's policy. That's not a school of medicine policy. That's not Truman's policy. That's what the surgery department has agreed upon. So I don't think other places might be like that. They may not be like that. But I know they did it more as kind of a safety concern for everyone. Now, I'm also a nocturnist, so I only work nights. So rules are a little bit different. So sometimes I let people, sneak in, but in general, you're not supposed to do that. So maybe it'll change. I don't know if COVID will ever go away. So we'll see.
That makes sense.
Yeah.
Bouncing off of that, so I'm a SLO student, so at least at SLO, all the students are required to submit their proof of vaccination, and SSM hospitals are doing that now for any student who's there. So if you're rotating through a hospital beforehand, should you just ask like, hey, do I have to submit proof of vaccination, or do you think that they would tell us that beforehand and how to do so?
They should absolutely tell you that you need that before rotating there. Because, not everyone is vaccinated, obviously. So if that was important to you, like, why would you apply to a program that required that? So I feel like if a program is not telling you that, that makes me feel, a little uneasy. So I feel like they should tell you at the beginning. And if they didn't, I feel like it's a little sneaky. So yeah.
Thank you.
And also at UMKC, we don't ask our students if they're vaccinated. We see that as, their own choice. Our hospital is requiring at least all of us to be vaccinated, which is going to the medical students, but it's not something we can directly ask them as of now until it's required. So I know a lot of hospitals are doing that. So I would watch out for that. But I know everyone who goes through Truman needs to be vaccinated by like the middle of September. But before then, I wasn't allowed to ask people if they're vaccinated. I would just, if they went to a room that was short of breath and febrile, I would just assume that they had the vaccine because that was them putting themselves at risk. But yeah, I haven't been allowed to ask that question. So after the middle of September, I think it'll be automatically assumed that you have the vaccine because then you won't be able to be there. Any other questions?
I have another one.
Yeah.
So looking forward, I know they've already decided for this year to do the virtual for interviews, but have you guys heard any talks about like moving forward, like year after that or year after that, in terms of like, do you think you have liked virtual enough that you'll just keep with it, or eventually is the goal to go back into in-person interviews?
I feel like all of us don't even know what we're wearing like tomorrow. So being on like those committees is really hard because we never know what's going to happen. We never know like what we're going to agree upon. So I can't tell you, like, I wish I could, but like we were all like almost 50-50, in person. Obviously at the end of the day, we want to do in person. Like that is our favorite thing to do. How do you get to know the city? How do you get to know like how the residents vibe? How do you know like what we had residents that didn't even know what the ER looked like because they didn't watch their video that we sent them. But, so that's really difficult and we acknowledge that. But at the end of the day, it's like safety for everyone. So just know that we want to do in person. It's just, I don't know what COVID's going to do. I don't know what, because ortho is doing in person and virtual. So it's very weird. And so we just wanted to approach it, as a unified like specialty that we were going to do virtual. So everyone's different. So I wish I could tell you. I hope we get to do in person in the future. And then I can type my email here so you guys can email me if you have any other questions. Like I said, I work nights, so if you get a response like at 3 o'clock in the morning, it's because I'm awake. But.
Well, if nobody has any other questions, I guess a last call for questions. Then I would like to thank you again so much, Dr. Camejo, for doing this and presenting this and like giving us a very candid look at, kind of both the process and both interview and rotation. I personally found it exceedingly helpful. So I really appreciate the time you took to meet with us and make this happen.
Of course. And I genuinely please email me if you have any questions or you don't have a mentor, if you want someone to read your personal statement. I'm here. A lot of people from UMKC are here for you, but please ask me questions. I'm an open book. I'll tell you how it is. And I'll help you, look over CVs or whatever you guys need. So yeah, I will always respond to emails. So if you guys ever need anything else, just let me know.
Yes, ma'am. Thank you so very much.
All right. Have a good night, everyone.